So good afternoon, everybody, and welcome to this Homeopathy 24/7 webinar on supporting cancer with homeopathy. And we're delighted to have Dr. Shrikant Talari with us this afternoon. Shrikant is a Homeopathy 24/7 homeopath, and he specialises in cancer. He's a medical doctor. He's been a homeopath for 14 years. And he said that he specialised in cancer because he likes challenging cases, which I think we can all agree is certainly the case if you're treating people with cancer. The webinar is going to last about an hour. If you have questions, please do put them in the chat box. And then at the end, there'll be a chance to ask questions specifically to Shrikant about his practice and how he works with people. So I'll hand over to you, Shrikant. Thank you very much.
Thank you, Sidomni. Welcome, everyone. Thank you for joining us today. And this is a patient awareness event for cancer. So let us learn about cancer first. And then we will slowly build up towards what are the various treatments and how to treat it, right? So, I think can you all please mute yourselves? Yeah. So, is my PowerPoint visible, everyone? Sidomni, is it? Can you see my?
Yes, it is. It's perfect, Shrikant.
Okay. Yeah, we can see the screen.
So these are the three main aspects that we'll be covering today. That is, what is cancer? What are its initial signs and symptoms? And what are its causes? What are the different types of cancers? Treatments available? And the main question that patients ask is, okay, I've been diagnosed of cancer and there are so many different options available. Which is the right one for me, which will work for me, which is good for me? What should I do? It's already a shocking diagnosis for me. Where do I go from here? So this webinar is precisely about where do you go from here and how do you handle cancer, right? So let's start with what is cancer. So cancer, to put it very, very simply, is uncontrolled cell growth. So all of us have cancer cells in our body. Every single human has cancer in their body. The difference between a cancer patient and a normal healthy human being is that in a normal healthy human being, the cancer cells die.
You can't get my MacBook charger from the kitchen, please.
So please mute yourself. And in an abnormal patient or in a cancerous patient, there is, instead of these cancer cells dying, they start to proliferate. And not only do they proliferate, they start invading other parts of the body. Okay. And because they are invading, they are eating away more and more of the healthy cells. And there is less and less of healthy cells in the body, ultimately resulting in death. So technically, the definition is cancer is abnormal cells which divide uncontrollably. Just 1 minute, I have to. Okay. Okay, does anyone know the function through which I can just click slideshow back again? Keynote.
It might be down at the bottom, Shrikant, on the bottom right. There's a picture of a U with a line at.
You did it, Shrikant. It's done.
Okay, you did it.
Okay. So cancer is abnormal cells that divide uncontrollably and have, can someone read what's it? Have the ability to infiltrate and destroy normal body tissue after injury. Cancer often has the ability to spread through blood, through your body. Actually, this screen of ours is coming in between, so I'm not able to read the right hand part. Okay, so that is what cancer is. Now, if you're suspecting that you have cancer, what are the initial signs and symptoms which will tell you that maybe you have cancer, maybe you should get yourself tested or examine or meet a doctor? So what are those signs and symptoms? There are around 8 to 10 signs and symptoms. You should have at least 2 or 3 of these. Every patient will have at least 1 or 2 of these. That does not mean you are having or you start suspecting. You should have a combination of 3 or 4 of these. Then you start suspecting, right? So the first is fatigue, means unusual weakness. I'm just feeling weak all the time, even if I work, even if I don't work. Just weak, slightest amount of exertion, I'm getting tired. Second is lump or area of thickening that can be felt under the skin. Weight changes, mean especially weight loss, right? Tumor, all of us know, some form of lump felt everywhere. Nowadays, everybody gets terrified. Is this a cancerous tumor? The next symptom about weight, especially if the patient has or if you have weight loss of more than 5 kgs in a period of 6 months, then you should get yourself examined. And if this weight loss is unusual, you're not doing any weight loss plans, you're not doing any dieting, nothing you're doing, but unusually your weight has started to reduce and you're starting to feel weak. And then you see skin changes, your skin turning yellow or dark or red, or you're developing sores, or your previous moles or previous injuries have suddenly started becoming inflamed or suddenly started to ulcerate. That changes in the existing wounds. Change in bowel habits or bladder habits, means frequent bowel habits, frequent urination, or constipated, not able to pass stools at all. Persistent cough or trouble breathing. Symptoms like these, like bowel changes, bladder changes, cough, difficult breathing, can be seen in many kinds of illnesses. But all these have to persist for a long duration. For 3 months, 4 months, I've been taking treatments, but it's not reducing. It's been 3 months now, it's been 4 months, and I am losing weight, and I am feeling fatigued. Now, you should suspect. Why am I losing weight? Why am I always feeling tired? What is this lump? Why is my bowel not getting better? Yeah, why is this cough there even after 3 months? Difficult swallowing, hoarseness of voice. All these symptoms, please know that these have to persist for at least more than 3 to 4 months. Persistent indigestion or discomfort after eating. Persistent unexplained muscle or joint pain. Unexplained fevers. Again, even fever, it has to be long term, 3 months, 4 months. Unexplained bleeding or bruising. If you have 3 or 4 of these symptoms and they are long term, that means this is the time to meet a doctor. Go and meet your doctor if you have these symptoms. What do? If your doctor suspects, he will investigate you. They will do certain tests. If they find certain problems somewhere, if there is a lump somewhere, they will do a biopsy. The most important and confirmatory test for any cancer is a biopsy. fine needle aspiration biopsy. Until then, no cancer can be confirmed. You cannot say that this is a case of cancer until and unless you have a fine needle biopsy microscopic report which confirms there are cancer cells over there. If this biopsy is confirming that you have cancer, then the doctors do a general body scan. They scan your overall body. They see how much it has spread. They do a test called as PET scan, where they evaluate which parts of your body have been affected by this cancer. Some cancers have tumor markers. So breast cancer has a tumor marker, prostate cancer has a tumor markers, intestinal cancers have a tumor markers. These tumor markers tell you how aggressive your cancer is. If the marker number is very high, means the rate of proliferation of the cells is high. This is very important to know how aggressive the tumor is, how immediately we need to act. So 3 things you need to look for. First, whether I do have it by biopsy. Second, you have to look for the spread. How much is the spread overall? And third is, what is the severity? How aggressive is this? How inflamed is this? Based on this, we have to go for treatment options. And first and foremost thing is, when you are looking for treatment options, most of the patients feel that now there is no hope. This is the end. Cancer means this is a death sentence for me. But today's day and age, majority of cancers have become such that patients are getting a very good lifespan. Anywhere around 5 years, 10 years, 15 years, some cancers even 20, 25 years, right? So don't worry. First, analyze. First, what you need to do is you need to know what cancer you have, what is exactly the modus operandi that you need to. Most of the patients panic, they get scared, they are shocked, they are sad, they are depressed, they become anxious. Oh my God, this is a death sentence. What do I do now? Rather than that, if we just focus on what the cancer is, we will know the truth. A lot of this anxiety is because we don't know. We don't know now what's going to happen. Should I start writing my will, is what majority of patients says. That we don't know, that unknown phase has to be replaced by knowing, by awareness. What should the patient know? So you should know about your illness. What do patients usually ask? At this stage, patients ask why they developed this illness, what are my treatment options, which ones should I choose? And from now on, this is the main agenda of our webinar today. What do you do once you're diagnosed? Correct? So 3 salient features is, first, look for, know your cancer spread, and third most important thing is comorbidities. Do you have diabetes, blood pressure, inflammatory bowel syndromes, etc.? These you need to look for. So there are many treatment approaches available, right? The first and most usual conventional approach is go for chemotherapy, surgery, radiation. The second is a more holistic approach like homeopathy. And third is natural means like diet, detox therapies, and nutritional therapies, etc. Now, which ones do I choose? Correct? So if we let us look at each one separately, and then we will be able to make a decision. So if we look at the conventional approach, the approach of modern medicine is to get rid of the cancer cells. Just somehow there is a cancer cell, just get rid of it. So either do you do a surgery and remove the tumor from the body, or you give a chemotherapeutic agent and it will kill the cells in your body, or you give radiation, it will kill the cells in your body. Somehow control it, restrict it by stopping all the aggravating factors in our body. So now what this does is, we have to remember one thing. If I do a surgery and get the tumor out, I have got out those cancer cells out of my body. But there is a reason why these cancer cells developed. And that reason has not been addressed. And till that reason is not addressed, the cancer is going to come back. Till that reason is not addressed, I am going to feel unhealthy. There is something inside me which is producing these cancer cells. Till that inside is not treated, there is no scope that it will not come back. There is no scope that I'm going to feel healthy. So these causes have to be addressed, right? If we take chemotherapeutic agents, what they are doing is, they are going to, most of the chemotherapeutic agents are derivatives of a compound called as cisplatin. And its main action is, it will act on all cells which are proliferating very fast in our body. Very fast proliferating cells will be destroyed, they will be killed. So what are the fast proliferating cells in our body? Firstly, obviously, cancer is one of those cells. But there are other cells like our hair, like our blood cells. Now, that is why you will see all cancer patients who take chemotherapeutic agents, they will lose their hair, their blood counts will drop, they will start feeling very weak and exhausted because all their blood cells are dead. And then the body has to completely produce new set of blood cells. But because they are very, very fast proliferating, you do recover out of. And most of the patients again have their blood counts coming back to normal. But in this approach, what is happening is, along with the unhealthy cancer cells, the healthy cells of our body are also dying, and this weakens our immune system. Similarly, if we look at radiation, it is only going to target certain kind of cells, and it is having minimal side effects. I think surgery and radiation therapy, they don't have a lot of side effects. And in many cases, I myself recommend patients that this is a surgical case, you will have to do a surgery. In some cases, there is scope for killing the cancer cells with radiation and then complementing it with homeopathy so that these cancer cells do not proliferate back. But somehow the idea of chemotherapy does not seem to fit in for us homeopaths. But in some very rare cases, very advanced cases, we recommend the patient to take a chemotherapeutic agent. But in majority cases, we feel it weakens the body a lot, and it should be avoided as far as possible. Correct? This is what the conventional approach is. So what is the homeopathic approach, the holistic approach? The homeopathic approach is to look for why did this patient develop cancer? What are the causes? And if you look at the causes, there are principally two types of causes. For any disease, we will focus on cancer. So there are two main categories. The first is intrinsic causes. Intrinsic means they are inherent inside me. Like I have a family history. In my family, my mother has had breast cancer. My sister has had breast cancer. So I'm scared I will develop breast cancer. This is a genetic predisposition. Correct? This is my body's problem. Nothing from external is influencing it. Second is my mental emotional state. I'm a very sensitive person, doctor. I can't forget if someone hurts me. I remember that a lot. I hold grudge. Or I have had a very intense childhood where there was violence and fear, etc. So all my emotions, feelings are just suppressed inside. I'm scared to express my opinion. These emotions have been proven to influence our body and produce cancers. So it is very important that we allow catharsis and we allow our body to heal at the physical as well as mental level. The third intrinsic cause is physical illness. So I have leukoplegia or I have inflammatory bowel syndrome. These diseases need to be healed so that they don't get converted into cancer. Then there are extrinsic factors, like most of us today are taught that we develop cancer because our foods are processed, or our foods have pesticides, or our air has too much of pollution, or our um, body is getting exposed to too many toxins in the form of mercury or mercury, heavy metals, etc. So what we need to do is we need to detoxify, we need to cleanse ourselves, etc. Or because of smoking, we develop cancer. What is important here is that, see, most of us, you will observe that one patient is smoking and he is a chain smoker and he does not develop cancer. And I am a person who lives a very healthy lifestyle. I eat healthy, I sleep well, I don't do anything wrong, and I develop cancer. But I see another person, he's smoking, but he does not develop cancer. Why does this happen? This happens because the problem is not always external. A lot of our problems are internal. It is our body's immunity that defines whether we will develop cancer or no. External factors will complement it. They will enhance the possibility to develop cancer. But there has to be an inherent predisposition within our body to allow this cancer to develop. That is where homeopathy comes in. It treats this inherent disposition. It treats the individual. The person should be treated. It is the person that is important. If this person's immunity is developed well, if this person's diet is balanced, if this person's mental emotions are balanced, if this person's diseases are properly treated, then he will not develop any illness, not even cancer. That is the homeopathic approach, to treat a patient holistically at mind, body, and at genetic level. So homeopathy is the only science where we say that we are able to nullify the effects of genetic predisposition. These are known as miasmatic remedies, right? So a family has a history that my mother has had breast cancer, so will I develop breast cancer? Correct? That tendency will be nullified when we give anti-miasmatic remedies. So patients who are scared, oh my God, I will develop cancer. What will happen to me? How will I manage? I have a family history, and then I just saw a recent lump in my breast, or I have a white patch in my mouth. My father had oral cancer. Will I develop this? Will I develop this? This tendency where the patient or the family has this fear of cancer or the predisposition to develop cancer can be handled with homeopathy by help of these miasmatic remedies, right? Okay. And once this person is healed, once I have as a person, my emotions, my immunity, my health, my physical illnesses, all this has been handled well, then even if you even if you expose yourself a little bit to these unhealthy lifestyles, you will see that you will not develop cancer. But if you have an inherent disposition, even after having the best of lifestyle, there is a good chance that you will develop cancer, right? So this is very important, that we have to recognize that disease is first internal and then external. External factors start affecting us only if there is an internal predisposition, internal capacity to get affected by it. That internal capacity has to be first addressed, and that is what precisely the homeopathic medicines do. They treat your internal organism. Now, once the internal, then Sidomni, are there any questions till now?
Not at the moment, Shrikant, but if people have questions, please do put them in the chat box.
Okay. Now, once this internal has been addressed, then we complement it with good diet, lifestyle, detox therapies, etc. But here again, what is very important is to individualize. Just to give you an example, suppose you say that I have breast cancer. So we have to see that what are the causes of breast cancer. And if you study breast cancer well, it is a cancer which develops because primarily the estrogen hormone is disturbed. Okay, so for example, you will see in the causes, if you go through the internet, that it is developed in old age people, people who don't never become pregnant, or people who have had early menstruation, or people who have dense breasts, or people who have had hormonal therapy pills, etc. Whether it is old age, whether it is menstruation, whether it is not having pregnancy, what all these things tell is that primarily in breast cancer, the estrogen level is disturbed, because of which the patient develops breast cancer. In such cases, for example, in breast cancer, to tell a patient that you take certain diet, your breast cancer will reduce, will not work. Are you with me? That what is generally taught to patient is you start eating healthy, your cancer or your disease will reduce. Not necessary. Suppose you have colon cancer. Colon cancer is because there is not proper digestion and excretion that is happening in the body. So rather than good nutrition, what we have to do is we have to eat certain kind of food which will help in expulsion of the colon. How do I put it? Any food which high fiber food which will cleanse the colon. Cleansing the colon, a diet which will cleanse the colon will help in colon cancer. Similarly, a diet will not help in breast cancer, but anything which can reduce the side effects of hormones will help. So there's no point in giving a breast cancer patient a diet, but a breast cancer patient should be more concerned with his mental emotional state. Somehow I feel I am not putting my point properly. Okay. Lifestyle changes, diet changes, detox therapies. Huh? So you have to basically individualize your choice of therapies too. Okay. Now, I think what I can do is I can share with you certain cases of patients who have done well with homeopathy. So
We've got a couple of questions on the section that you've just done, Shrikant, if that's okay.
okay.
Yeah. Somebody's asking, why does restriction of hormone stop the activity of cancer cells?
Yes. So see, a hormone is responsible for the cell's growth and proliferation. So if you are not going to expose those cells with that hormone, it will not allow the proliferation. So typically there are two types. The most important hormone that is used is statin. Somatostatin is used. This hormone is a hormone which suppresses all body cell proliferations. All activities in the body which have to do with proliferations are dulled down. That is what statin, somatostatin does. So that hormone is given so that the proliferation of cells reduce. Similarly, if you see, for example, estrogen, it is going to encourage proliferation. So you don't want this hormone to act. So they give medicines to stop the receptors in the cells to receive stimuli from this hormone. So once they don't receive stimuli from this hormone, they will stop proliferating. Did I answer your question?
I think that answers the question, doesn't it? Next question. Why is radiation considered less harmful than chemotherapy?
Because radiation is very, very specific and targeted. It will not touch any other body parts of yours. It is directly targeted to the cancer cells only. While chemotherapy will affect all the cells of the body, radiation is very, very specifically targeted. Only that one part of your body is isolated, and only that one part will receive radiation.
Thank you. And what do you mean by detox therapies? Do you mean homeopathic detox protocols?
Yeah, there are many detox therapies. There is homeopathic, there is natural ways, etc. So that is what I was trying to explain. Let me give an example and explain it to you. So I have one case of colon cancer, and colon cancer is a cancer which develops if the patient has a chronic constipation. Okay, Ceacum, chronic constipation. So in such cases, anything that can improve the constipation will ensure that there is no toxin accumulation in the colon, and hence there is no toxin, so there is no damage to the cells, and hence there is no cancer cells. Correct? Now, this patient comes to me, I treat him, and he's overall complaints improve. In 6 months time, he's much better. In fact, his cancer cells activity reduce in the subsequent scans without taking any chemoradiation. But what happens, what concerns me as a physician is, even after 6 months, he's complaining, I still have constipation. This means I have to somehow now ensure that the constipation improves. Otherwise, this patient will slowly develop cancer, if not today, in subsequent days, because the constipation will ensure that there is toxins inside the body. What we generally do is, we think that do any therapy which will detoxify. which will get these stools to pass, or which will reduce the amount of toxins in our body. Now, in this case, I felt, okay, one detox therapy that we can use in this case is I give him very high fiber diet. So he will pass stool because of this high fiber, and the constipation should improve. But in this case, we first tried wheat grass. It did not help him. Then we tried some liver detox therapy. It did not help him. Then we tried some other therapy. I don't remember. That also did not help him. This is the time what I did is I studied his overall lifestyle. Where is it that because of which this patient is not getting out of this constipation? And while I was studying what is your diet like, what is your lifestyle like, what do you eat, when do you sleep, etc., that time he said, doctor, one interesting thing I want to tell you is I had this habit of eating butter. Every day I used to eat butter, but just around 2 years before I developed cancer, my doctors told me that now your cholesterol is high, you have heart complaints, you have diabetes, so you should stop that. So I stopped that. Just yesterday, no, I felt I had this strong urge to eat it. So I ate. I said, forget about health. For one day I can eat. I ate that butter, and today morning I had really good stools. My stools were perfectly normal. And if I eat that, no, I'm perfectly normal. I have no constipation, and everything seems to be better. So I said, you should eat butter every single day. But then he said, then what happens to my cholesterol? I said, don't worry about cholesterol. That I can treat with homeopathy. But if you don't treat this constipation, you are going to land up in this cancer again. So he started eating butter again, and his whole constipation got better. It's 5 years now. This patient does not have any cancer. His constipation is also completely healed. What we can learn from this example is there are hundreds of detox therapies. Okay, the first thing that we have to know is detoxification applicable to the type of cancer that I have? I'm having breast cancer and I'm saying I will detox my body. It will not work. Are you with me? Can you get this? But I have colon cancer. I want to do detox therapy. Correct. The direction is correct. Second point, what we can learn is, even if you want to do a detox therapy, it has to be something that suits you. You get this? We tried many detox therapy. We give him wheatgrass, it does not work. We give him liver detox, it does not work. What works is what suits him. Can you get this? Everything, this is the main principle of homeopathy, that is individualization. You have to individualize. You have to first see what is the cancer, what does this cancer need? That will define your approach towards it. Then you have to follow it up with the therapy that suits your body. If you do that, then you will have very good results. Am I clear? Did I answer your question?
That's great, yes. Thank you. Final one for the moment. Are the statins you mentioned the same as the statins used to reduce cholesterol?
No, they are different. They are different.
Thank you. That's all the questions for now, Shrikant.
Yeah, but thanks for the question. I think with this last question, I could answer the concept of individualization, because I was not very sure whether it went very clearly. Now I think, now everybody understands, know the importance of individualization. Understand your cancer, treat your cancer the way it has to be treated, and then follow it up with the one that suits you. That's where the homeopath helps you. he or she will not only tell you what needs to be done, but he or she, by studying your whole history, your whole diet, your whole lifestyle, your whole mindset, he will be able to suggest the one that is suitable to you. Hmm? I think there's one more question. No?
I think some more have come up.
Yeah. So, yeah, there.
It's somebody explaining the difference between somatostatin and statin drugs, and somebody saying that your explanation through the example was very good, thank you. What's the best remedies to treat cancer?
The best remedy to treat cancer is the one that suits your individualistic symptom. So what does this mean? Let's take the same colon cancer case. So for example, this colon cancer patient does not come to me before he has developed cancer. And he comes to me at a stage when he's having this chronic constipation since the last 2-3 months. So what the homeopath does is he will not give you a remedy just for the constipation. He will give a remedy for the characteristics of your constipation. So what does this mean? That when is your constipation? What is the character of your stool? What is the color of your stool? What is the smell of your stool? Because these characteristics of how they look, how they feel, how they smell will define how intense the toxin accumulation is in the body. And if at that time you are given a remedy which will detoxify you and which will improve the constipation there and there itself, that remedy will ensure that you are detoxified also and you don't develop the cancer also. So it is very important to find a remedy which is characteristic to your symptoms. So I am in a way not wanting to answer your question directly by telling you some particular name of remedies, like this 4-5 remedies are the remedies for cancer, because there is no such remedies for cancer. That's the whole objective of today's session, is to tell you that we have to choose one that suits your individual personality. So the homeopath has to study your genetic predisposition, has to study your lifestyle, has to study your mental emotional state, has to study your physical symptoms, and he has to find a remedy that suits all 4 of these. A perfect tailor-made remedy that suits all 4 of this is the remedy, the best remedy, that will ensure that not only will you get cured of your cancer, but you will not even develop the cancer again. That is the actual treatment of causes. There is no single remedy like that. Am I clear? It is there's no remedy like that. Because as I told you, our whole approach is not to kill the cells. If I want to kill the cells, I will tell you, okay, this medicine kills cells. What the homeopathic approach is, the approach of healing the body, is educating the body and telling that okay, good, this one point was remaining. See, telling a patient that, I took your history, and from the history I can see that you don't sleep well, and because you don't sleep well, you don't eat well, and because you don't eat well, you're having all this toxin accumulation and you're developing cancer. So the patient tells us, but doctor, see, I have so much of stress in my life that I'm not able to sleep. or you know, I want to sleep, I feel sleepy, but you know, I have this strong habit of smoking. If I don't smoke, no, I'm not able to pass stool, so I have to smoke, and I know this smoking is going to land me up in cancer. Now what will you do in such patients where you see that there is a cause and the patient is not able to overcome? This is again the scope of homeopathy. It is the only medicine which can help a patient to overcome these compulsions. Suddenly, a patient who is compulsive about having to smoke starts feeling that it's okay, I can do okay even if I don't smoke. Suddenly, a patient who has had so much of stress and he was not able to sleep starts feeling that my mind is calming down. Nowadays, I get sleep. What did you give me? I'm starting to sleep better. I don't get dreams like I used to. I feel so refreshed. I don't want to eat that unhealthy food. Now my desires only are starting to become healthier. I want to live healthy lifestyle. It's not that someone told me and I have to, otherwise I will. It's not out of fear or out of compulsion. The homeopathic remedy will create an inner desire in you to live healthy, to breathe healthy, to think healthy, to feel light, to handle stress. It will help in coping up with stress. That is the scope, and this can be done only if we find that individualized remedy. Right? So did I answer your question? Who asked that? Mirai. Hello? Hello? Yes. So Dominic, did I answer that question?
Yes, you answered that question. That was holistically with Miral. Asked that question.
Okay. Any other?
We have one more from Heather asking, what a friend is starting chemo on Friday and is worried about nausea and neuropathy. Is there anything you can suggest that may help with these side effects?
So there one is see, each patient, it comes back to the same thing. I am smoking, still not developing cancer. I am being exposed to a chemotherapy agent, but still developing little symptoms. I am exposed to the same chemotherapeutic agent and developing so many symptoms. Some are developing this many symptoms. Some are developing this many. Some are developing this many. So it again comes back to be able to find a remedy based on the symptoms that the patient develops. Correct? The first and foremost thing in your patient that needs to be done is the fear factor. This patient is scared that I may develop. She has still not developed. She's just scared that I may develop. First, the fear has to be addressed. She has to be calmed down. She has to be given some remedies to calm down that fear. Once she takes the chemotherapeutic agent, you can give a remedy that suits her symptoms. Secondly, we should study the chemotherapeutic agent that she's receiving. Most probably, if she's receiving cisplatin or carboplatin, she will have hair fall, weakness, all these symptoms, and these will get resolved on their own. See, I want to tell you one thing. I work with allopaths, okay, and you know, patients, many patients who are taking chemotherapy, they ask a homeopath that please give me some remedy so that my side effects for chemotherapy reduce, and then they come back to the allopath and then they say that, oh, I took that homeopathic remedy and I feel better. The allopath says, what, in what way? He says, the patient says, I'm not feeling as weak. I think my hair grew back faster. My blood counts have come back normal, etc. But the allopath, they tell me that all these things happen even if you don't give anything. You don't need to treat it. Why are you homeopaths unnecessarily taking credit for something that the body is normally doing? So it is very important, what I want to tell is that it is very important that we know that this patient really needs a remedy. Most of the side effects recover on their own. And we have to tell patients that you will get better, give them confidence. That's the first thing they need. You will come out of this. If you don't, I'm there. Let me see symptoms that this symptom really needs to be treated. Then we will give a remedy for that symptom. Are we getting this? This is very important to get an individualized approach. If we don't do that, then it's all vague. I gave this remedy. For example, I can tell you remedies. No, I can tell you that take cisplatin, take cisplatin in potentized form. It will reduce the side effects. But it does not. I'm really sorry to say, with clinical experience, I can tell you it does not. Or we give radium bromatum for patients who are receiving radiation therapy, or we give cobaltum for patients receiving radiation therapy. If you give it to 100 patients, maybe 2 or 3 patients feel better, and they feel better because their remedy that they need is itself radium brom or cobaltum. Are you getting this?
Thank you.
This individualization is very important. We have to get this insight that it's not any external factor is not the cause of disease. What or how my body responds is what needs to be treated. Don't just be scared. I took chemotherapy means I'm going to have side effects. Now it's the end. No, hundreds and thousands of people are taking chemotherapies. Nobody is dying. Sorry, few people are dying. Few are not. Few are having severe symptoms. Few are having minor symptoms. I know patients who have no symptoms. I know patients who have weight gain and feel healthier after taking chemotherapy. Have you heard?
Shrikant, so you're talking really about a totality
Yes.
along the way as much as possible, and then the odd individual specific if you need to.
Yeah. Can I know who is speaking? I can't see.
It's Ali.
Ali. Okay. Yeah, Ali. Yes. Yes. You have to look at the individual symptom. What is it that is disturbed in this patient that needs to be treated?
Yeah.
See, it's like this, to give another analogy. I got hurt. Suppose I am walking here. I fall down. I got hurt. Should I take a remedy for that? I should not. Matlab, my body should be good enough to heal itself. But but if a patient says, oh, it's very painful, I'm not able to tolerate the pain, then I will treat the pain. Some patient will develop infection, then I will treat the infection. But you fall down, okay, you start taking remedies. It's the same thing. I took chemotherapy, let me start taking remedies. Are you getting this? Don't do that. We need to be more scientific in our approach. A lot of this comes out of fear, anticipation, and panic. Oh, I'm doing something that's going to harm me. Now, what to do? What do I do? What do I do? What do I do? What do I do? We have to tell patients this fear is the problem, not chemotherapy. The first problem is the fear.
So are you saying in a case when they've had chemotherapy to let the body self-heal, but when the patient's going, well, look, I'm still suffering with that, and I've got this and I've got that are a problem to me, then you treat that. So you really only dip in and out.
Yes. Don't try to treat everything.
We've just got a question here, Shrikant from Morale, saying, can you share a study case?
Yeah, that was exactly what I was going to do. So let me share my screen. So I'll just show you some cases. Yes, so oh, take it. Yeah. So can you see my PowerPoint?
Yes, we can. Yes.
Hello?
Yes, we can.
Yes. Okay. So this is a case of nerve cell tumor. And she had cancer 1 year back. She has taken treatment. She has undergone surgery, radiation, chemotherapy, everything. But after 1 year, the cancer relapses. And then, as I told you, we first study what is this cancer, what is its aggression, etc. So it's a nerve cell cancer, and it's one of the aggressive forms of cancer. It relapses most often. Okay, so only 26% individuals survive for more than 5 years. So then here you see, this is the report she came to me with. This is a known case of malignant nerve sheath tumor, post-operative. Follow-up study shows FDAG avid soft tissue lesion involving psoas and adjacent muscles. The third line says a detailed possibility consisting of disease relapse. So there is a disease relapse over there. The disease has come back. So what do we do homeopathically? We study the case. We look at why, what is the onset, location, symptoms, modalities, concomitants, mental symptoms, etc. So we study everything. So this is what came up. She has had profuse bleeding, after which it developed very fast. It's on the left side. There's pain and other symptoms. We look at modalities, and then we look at the mental state. Her main mental state was coming for homeopathy is a big risk. I'm not going for the conventional things, and coming for homeopathy is a big risk. My surgery was such a big risk. There was 2 surgeons who rejected, and they were scared to operate on me because they felt it was too close to my spine and my whole body would get paralyzed if even one nerve we would have cut here and there. So my whole cancer is very risky, treatment is very risky, everything is very risky. And in such a risky situation, what we need is courage and strength and determination that no, we will do it, we can come out of it, etc. That was how her mental state was. So this way we analyze the case, and then we gave a remedy, and we see after 6 months of treatment, no obvious FDAG avid lesion is appreciated. So her cancer completely disappeared after 6 months of treatment, and this was done only with homeopathic treatment. She did not take any chemotherapy, radiation this time, and this was achieved only with homeopathy. Yeah. So that was one case. Just to be clear, what do you expect when you say that show me a case study? What I did is good enough, or I want to show more cases, or you want some more details? I will request you, the audience, to please guide me what they would like to see in this case studies.
Names of remedies is quite useful because obviously they'd be different for every patient, but that might have been quite useful to have the name of the remedy for the fact that she was so fearful of the operation, and you put fearful of fights, of going with homeopathy, not allopathy and whatever. Yeah. That might have been useful, but
she received the remedy chromic acid. Yeah, and Ali, our main objective here is for patients, so I have not purposely described the characteristics in detail. Yeah.
I would like to know a bit more, Shrikant, about the course of the case, the course of the treatment, and what aspects came up as you went through. You know, was it always mental, emotional, or were there physical aspects to treat? What was, yeah.
It was both. It was both. So she had firstly this fear and, you know, of cancer and death. Secondly, she had complaints like backache. Obviously, her tumor was in the back, so she had symptoms like backache, and she had weight loss. She had weakness, etc. So within the first 1 or 2 months of the remedy, the backache completely disappeared. The energy came back. She started feeling rejuvenated. And then subsequently, we observed that the backache was relapsing. So I had to increase potencies and give it in different repetitions. And then in 6 months, the report also came back normal.
But this was more than one remedy. Are you?
The only remedy you used, or did you use other remedies apart from chromic acid?
Thank you.
Only one remedy. In this case, only one remedy. In most of the cases, in most of my cases, if you find the right remedy, generally it does not change. Remedies change when the whole picture changes. Means sometimes it happens that patient had nerve cell cancer, you treated, that's gone, and then patient starts saying that unusual complaints. I have started developing stomach complaints. I never had these. I'm having acidity, or I'm having headaches. Completely new disease, completely new picture comes in, then you think of different remedy. But usually, if we are able to hit the right remedy, that remedy does everything. It's just that we have to manage the potency and repetition.
Did you find the right remedy the first time, or did it take some research?
First time.
First time. You're good.
14 years of practice. And it's hard work. Matlab, in India, no? Are you a homeopath? Who asked this question?
I did. I'm a beginner. I'm a yeah, I'm just starting in homeopathy.
That's Teresa. If you're asking a question, could you say your name? Because
I'm sorry. Yes, I'm Teresa. I'm from the United States.
Yeah. So, see, Teresa, all this can happen if you have good exposure. So I have worked in cancer hospitals. I have worked in homeopathy cancer OPDs. I worked with big homeopaths. I've worked with Dr. Sankaran. I've studied with Whitney Cause, and all stalwarts all over the world I've studied with. So lot of exposure, lot of knowledge, and a very good clinical sound knowledge also by working with allopathics. So all this helps. If you do that, you will also be able to.
Thank you for your time. Appreciate it.
So people are asking if you have any more cases that you could share.
Let me continue. So I will just briefly only mention cases because our main scope is to show patients that homeopathy works, and it's a good means to. Okay, now this is a case of chronic myeloid leukemia. Okay, chronic myeloid leukemia. This is a 76-year-old man, and where is this PPT? Okay, now this is how chronic myeloid leukemia is. Okay, its general tendency is it has 3 phases once it's diagnosed. For 5 to 6 years, patient is dormant. They have no complaints. Then they enter the accelerated phase, means patient develops tiredness, weight loss, there's spleen enlargement, his blood report starts to alter, etc. And then once this starts to happen, within the next 3 to 6 months, patients die. This is if they take chemotherapy. There's no other treatment. This is a blood cancer. Myeloid leukemia means it's a cancer of the blood. So there's no radiation or a surgery as an option. The only option is chemotherapy. If they take chemotherapy, then the average life expectancy of a patient is around 6 to 9 plus 3 to 6. So let's say 1.5 years. If we consider maximum also 9 plus 6, correct? Not even 1.5, 1 year, 3 months is the maximum time limit that the patient will live. Now, this patient of ours was in this intermediate phase because whatever, I'll not go to the symptoms. He had this weakness, and you see his blood reports, his in myeloid leukemia, mainly the RBCs, the platelets. Can you see at the bottom, platelet count 1,06,000? Yeah, can you read that?
Yes.
Yeah, and then you see WBC, the second from the top, 3,100. 3,100.
Yeah.
From top. The third from top is RBCs, that is 2.88. These are WBC are white blood cells, RBCs are red blood cells.
So
Correct?
his counts were very low.
Yes, yes. That is, these are the 3 cells that are affected in myeloid leukemias: RBCs, WBCs, and platelets. Okay, this is when he came to us. Now, to cut the long story short, I will show you reports. Subsequent reports kept improving, kept improving, kept improving. This is when 2021. Yeah, I think this is 2021. This might be Jan or something. So you see his WBC is normal. It is not low. His platelet count is normal. Yeah, his RBCs are also normal. And this is after 2020 he started. This is 2022. So it's after 2.5 years, the patient, instead of dying, he is improving. He's having a better count. He's almost having a normal count after 2.5 years. Yeah. Did you all appreciate the reports?
Yes. Was this all due to homeopathic remedy, or did you do something else besides the remedy?
All cases that I'm sharing today are exclusively treated with homeopathy. No
Okay,
other.
thank you, sir. Thank you.
Exclusively treated by homeopathy. See, even if he would have taken chemo, he was going to die in one year, 3 months. So it's much better not taking chemo and living for 2.5 years. And he's still alive. Yeah. Just last month I saw him. Okay. Any questions with regards to this case?
Lisa's asking what are normal RBC and WBC counts?
They're given there, no? I will generally, no, every see the counts in India and in US or in Australia is different because the labs, they use different scales. So you have to look at the range. You can see on the right hand side, they have given the normal range. So for WBC, it is 2.51. The range is 4.5 to 6.5. Can you?
We can't see your screen, but.
Oh, sorry. Let me share my screen. Okay, so I've opened this report. So you see WBC. Can you see my cursor?
Yeah.
Yeah, so this is WBC is 2.5. The normal range is 4.5 to 6.5. Okay. WBC is actually slightly lower, huh? Okay. Sorry, RBC. WBC is leukocyte means WBCs. it is 6,200. The normal is 4,000 to 11,000. So WBC is normal. Platelet is 1,33,000. The normal count is 1 lakh to 1.2 lakhs to 3.5 lakhs. So platelets and leukocytes are normal. Yeah, can you get this?
Yeah.
And these reports you have to read according to your city, because this range varies, because the scales every lab uses is different. That's why they give this normal range right beside. Okay. Have I answered your question?
Yeah. Thank
Okay.
you. Monica is asking, do you just give one remedy at the time?
Yes, only one remedy. This patient I gave ars sulf rubrum. Ars sulf rubrum. Arsenic sulf rubrum.
And with the ALM case, somebody's asking which remedies did you give there?
This case ars sulf rubrum.
Yeah, the other one, I think.
Chromic acid. Chromic acid.
Thank you.
Okay. So should I go on to another case?
Yes, please.
Now, okay, let's see this one. Ceacum. Okay. Now, this is very important. This is a case of Ceacum cancer with uncontrolled diabetes. So even if the normal average expectancy is 33%, once you have diabetes, you should consider that by reduced by 50%. So there's only 15% chances now. Are you getting this? Comorbidities, especially diabetes, means the overall expected survival rate itself drops by 50%. Right now, this patient came to me in 2018. He's with me for now 5 years. This is what he came with: a operated case of well-differentiated adenocarcinoma of cecum. Present scan shows FDG, avid retroperitoneal, mediastinal, and bilateral supraclavicular lymphadenopathy. Correct? Now, in this case, he's with me for 5 years. These are his other reports that have been good. Now, out of this, I told you one of the important things in cancer is tumor markers, right? If you read the list, the third, the fourth one, and the fifth one, that is CEA and CA. These are two cancer markers, tumor markers. So you see those two markers are also normal now. You know, in 2018, after starting treatment, and even after 1 year, they seem to be normal. So in 2018, they are 4.7, and 19, it is 4.4. In the other cancer marker, that is CA 19.9, it is 29 in 2018. It is also normal in 2019. It is, I have not mentioned the present values in this PPT because this is a very old PPT, but his tumor markers even today are normal. And what is very interesting is he went to his oncologist after 2 or 3 years. They were not giving him chemotherapy, etc., because they said that you have uncontrolled diabetes and we are not able to give you chemotherapy. That is when he had come for homeopathy. So they say, the report says, persistence of weakly metabolic. This is very important. Weakly metabolic, that is underlined over there. Supraclavicular and abdominal nodes. Minimal decrease in metabolic activity of the aorta and aortoclaval node. This suggesting that the disease is stable, that the disease is not progressing. After seeing this report, the oncologist herself was very surprised. She asked, what treatment are you taking? Because this definitely does not happen with our medicines. No chemotherapy can do this. No surgery, nothing can do this. What did you take? This patient said, I take homeopathy. She said, very good, please continue. This is what the change is happening in India now. If we show good, consistent results, even the conventional oncologists are accepting that homeopathy has a role and patients are benefiting from it. Now they also refer cases to us, but they want to see that you really help, right? Hello? So this can happen, this does happen, and this happens consistently if we are able to find, individualize the whole. If you ask me, what is the trick? What is the secret to do this consistently? The secret is only one. Find individualized remedies, put all your energies into it. For the homeopaths, we'll talk some other day how to find individualized remedies.
Monica is asking, Shrikant, what do you think about carcinosin for breast cancer?
Sorry, I couldn't.
What do you think about carcinosin for breast cancer?
If there are symptoms that indicate that carcinosin should be given, we should give. But it should not be given that for every cancer case we should give carcinosin. Everything in homeopathy is individualization. Is this patient showing symptoms of carcinosin? If yes, give it. If no, don't give it.
Thank you. Teresa's asking, what resources do you recommend to get to know your disease so that we know how best to address it?
She's a patient.
Teresa Oman, who's attending.
No, not a patient, just someone that you had said in the very beginning of the presentation that as to go to individualization, and we need to know the disease and what it is and this our symptoms and things like that. What resources do you suggest to do that? So like, for example, if I am diagnosed with breast cancer and I need to know, where so that I, know how to address it, what are the resources I need to go to find out exactly what the cells are that are needing to be addressed? Does that make sense?
Yeah. So let me just repeat your question. You're saying, how do I understand my disease and know what needs to be treated?
Exactly. Yes.
Correct. So how do you understand is, firstly, you have to look at three aspects. First, look at the clinical aspects. Try to understand the causes. Second, establish the severity of your illness. What are your markers telling? What is the extent of the illness that you're having? Then you decide. Today I told you what chemo will do, what surgery will do, what homeopathy will do. Then you have to decide, okay, my tumor is too big. I better get it operated and then continue homeopathy along with that. Right? My tumor is completely gone. Now let me start with homeopathy. Or do I need to take diet in this case, or do I need to take some other emotional therapy in this case based on the cause of my disease?
How do you know what the cause is, I guess, is the question.
I think that cause is very difficult. If you ask me, what is the cause of my illness, I'll find it very difficult to answer that question. That generally we need someone else to evaluate us. It's
Okay,
very difficult for a patient to self-evaluate.
okay,
I
so
might
is,
go to a homeopath if I want to treat myself.
okay, so basically what your suggestion is to seek out a homeopath to help pretty much, you know, with that whole area.
Yes.
Okay, thank you. That was what I was looking for right there.
Yeah. Yeah.
Okay, I think we're running out of time now,
Yes.
Shrikant. So was there anything else that you wanted to show us?
There was one more case, but I think we are over time.
We're at 10:02.
Yeah.
So we've nearly an hour and a half. But
Yeah.
I'd love to see another case. I don't know about other people.
Yes,
Yeah,
please.
lots of nods there. Yes, please.
Okay, I will show you one case of, is my screen sharing on? Okay, should I play a testimonial? A video? I can't show you video because the patient had requested not to share video, but I can play the video and you can listen to the audio. Would that be okay?
Great, yeah.
Okay, so let me just first share the patient's reports with you. So this is a 65-year-old female who has neoplastic lung mass in her endobronchial extension, mediastinal node metastasis, and hepatic metastasis. So it spread all over. And she was told that you have around 6 months to 1 year max to live. And that is when she came to us. Okay. Now this is a palliative care. In this case, you can't do much. So all you can do is give quality and quantity of life, improve the quality of life and the quantity of life. So when this patient came to us, she had complaints like she had severe coughing, blood vomiting, breathlessness. She couldn't go to the toilet on her own. She had to be helped. She was getting admitted to the hospital every 10 days for some IV fluids, for blood, etc. That is when she came to us. After the remedy, I gave her the remedy acid phos. After the remedy, she completely started to become independent. She started to walk about. She started to do her own daily activities. She didn't need help in her daily activities. She sort of stopped having any hospital admissions, and she lived for 4 years. For 4 years she was lived. She's not there anymore now, but she lived for 4 years. What is interesting is the main cause in this case was she had this grief after losing her daughter-in-law. She was always feeling sad, and out of this sadness she never recovered. She was constantly thinking that my daughter-in-law is dead. She has left behind 2 children. Who will take care of them? How will I take care? I am also ill now. What will happen to them? This was her constant thought. After the homeopathic remedy, after 3 to 4 months, she says, now I don't think of my daughter-in-law. Now I think of those children and I start taking care of them. I feel I am okay now. Interestingly, I will tell you one very important thing is this, that this patient's relative is a radiologist and they have a MD physician also in their family. After 2 years of treatment, they were absolutely surprised that she is alive. So they
Let's just wait and see if Shrikant's internet comes back. At that cliffhanger moment. I think we've lost him for the moment.
I agree with Jessica's question. I'd love to know the potency out of interest to see how, how he went in.
I think the answer might be it was matched to the vital force of the patient. But we can ask. I've put a link in the chat, well, not a link, I've put a message for people who would like to contact Shrikant. If you go to our website, our team page, I have put the link in, and just scroll down a bit, you'll find his bio, and that has some lovely testimonials from patients, as well as the link to his free 15-minute discovery call. Sorry. Okay, I'm not sure if Shrikant's going to be able to come back, but we can wait for a minute. Are there things that people would like to ask or know that, oh, here he is. Coming back in. Shrikant, back with us.
Hello.
Can you hear me?
Yeah,
Yeah.
I think my internet went away.
It dropped out. You were at a cliffhanger moment with the 65-year-old patient. The radiologist couldn't believe.
Yeah, the radiologist couldn't believe. So they re-investigated whether she really has cancer. Then they confirmed that no, this is a case of cancer. What surprised them even more is after 6 months, she climbed up 2 floors without support. They said, how did she do this? Her whole left lung is completely collapsed. And this patient is walking up and down the stairs. She should be on the bed. She should not be able to move from side to side. Forget that, she's eating, she's living like there's nothing happened to her. Yeah, so I'll now just play the testimony of the relative. Yeah, I'll not be sharing my screen. Sidomni, if you can just help me if the audio is clear.
Okay.
I will tell you when I start. Can you hear?
At the age of around 70, my aunt was detected with the cancer.
Yes.
And
it's loud enough, clear enough?
It would be good if it could be a bit louder.
Louder. Let me try with another player.
At the age of around 70, my aunt was detected with the cancer by Homeopathic treatment, and we as a family was shocked for that situation.
Is this clear? Was this clear?
It's not very easy to hear, to be honest.
And given her situation, we were not very comfortable with any sort of treatment because she was very weak and she was very afraid. In fact, she refused to do the CT scan. And after our repeated requests, somehow she agreed for that. And finally, it was diagnosed as a cancer in advanced stage and spread almost all over the body. That was a initial fact we realized. Then we haven't suggested that she was not having the life more than 6 months or 1 year. But we were not having any alternative given her condition. And in fact, we could not disclose her that she is having a cancer of such an advanced stage. Then we tried with the conventional treatments, apart from the allopathy, because the way we were doing that allopathy is having only either surgery or radiation therapy, which she could not. She was not in no way she was ready for that. So after our repeated try with the alternatives available, conventional alternatives, I have came to know about the Dr. Shrikant Talari through my various colleagues who have we have been in a personal experience with him. So then we approached to him. Initially we were very skeptical about this situation. In fact, my aunt, uncle, both of them was very skeptical about this situation. But since her suffering was elevated to such a level, she was not able to breathe properly. She was continuously coughing, and she was not able to sleep, and she was losing the weight drastically. That was the fact when we approached to the Dr. Shrikant. Then one fine day we started to meet Dr. Shrikant and opted for his treatment. And within that first 1.5 months only, she started to realizing the gains. She started coughing lesser and lesser and lesser as the time progressed. And after 6 months, we realized that she is also gaining the weight. That was the most dramatic part of that situation. Where some of our relatives who are the doctors and radiologists, when we briefed this finding with him, they were surprised to know. They said that this is something miracle is happening with her. And she was very happy. Once upon a time, she said that, Nitin, I don't need any treatment now anymore. I am fully fit. That was her remark. So that was the way we were gaining the benefits from the Dr. Shrikant Talari's treatment. And the amount of the suffering we had and the coughing and this blood vomiting that was absolutely nil. And she was doing very well. She started doing very well. In fact, once upon a time she climbed 3 staircases. That was a real puzzle for me. So after when the allopathic doctor suggested us a life of 6 months to 1 year hardly, that too from our close relative, she could pull on very good normal life for 3 to 3.5 years. That was the real achievement of this treatment. And her
finally her death was also very smooth. She had no pain, no suffering. One day, just like that.
Awesome.
The potential of homeopathy. So the main message is put your heart and soul to find good individualistic remedies to see miracles. And
Shrikant, can you tell us the potency? I know it's very individual, but I'm interested. Do you remember the potency of that remedy you gave her?
Last case?
Pardon?
Of the last case?
Yeah.
Lung cancer.
Yeah.
She was given 200 initially. Then I gave her some LM potencies also, then 1M also.
Lovely. Thank you.
Started with 200.
And what was the remedy that you used there, Shrikant?
Acid phos.
That's absolutely wonderful. Completely mind-blowing, actually, for me. I'm sure I'm not the only one who feels like that about those cases that you've shared, Shrikant. Thank you so much. Does anyone have any last little questions before we finish?
Yeah, Sidomni, if anyone wants to contact me, they can contact me through website.
I've put the information in the chat for people for email regarding slides and recordings, and also to go to our website page, our team page, for your bio and your link there. Everyone happy with that? Yeah. Okay. It's been an absolute delight and privilege to have you, Shrikant, with us this afternoon. Thank you so much. I'm sure everybody else feels exactly the same. We're going to finish there, and I'll stop the recording.